Good afternoon. I'm Greg Cox, Chairman of the San Diego County Board of Supervisors, and this is our daily briefing on the COVID-19 situation. As was mentioned, we will have a number of speakers today. We're going to start off with Supervisor Nathan Fletcher. He'll be followed by Dr. Wilma Wooten. Dr. Wooten will be followed by Dr. Eric McDonald. Dr. McDonald will be followed by Dr. Nick Efantides. And Rob Sills will be providing us some information in regards to the Medical Operations Center. Earlier this week, I mentioned that our local businesses and organizations are helping out during this time of crisis. We've seen supermarkets open up earlier hours for seniors and those with disabilities so that they can get access to the goods and services that those stores provide without having to contend with large crowds. We've seen the American Red Cross and the San Diego Blood Bank get the word out about the need for more blood donations, and that need still continues. Facilitating access to coordinated transportation, or FACT as it's referred to, is a nonprofit that provides transportation to people who need it. To assist during this crisis, FACT is offering free transportation for San Diegans who have essential need to go to doctors or to go to grocery stores or to other essential trips that they have to have. And they're going to provide this service through April 15th for free. Seniors, persons with disabilities, students, veterans, and other residents who need assistance may call FACT at 888-924-3228 between 8 a.m. and 3 p.m. Monday through Friday to request free transportation anywhere in San Diego County. And again, that phone number is 888-924-3228. Please have the names of the rider or riders, the pickup address, and the pickup time available when you call. If you use a mobility device, including a wheelchair or scooter, please specify when requesting pickup. Free rides are offered on a first-come, first-served basis, and it is suggested to call at least one day ahead of the ride when possible, as there may be a limited daily capacity. And again, these are rides for essential needs allowed under the stay-at-home order, like grocery shopping. Thank you to FACT and for making these rides available. Again, this is one more example of how everybody is coming together. Today we have some very important news, and to get started, I'm going to call up Supervisor Nathan Fletcher.
Thank you, Chairman Cox. As we see the increased number of positive cases, the increased number of folks being hospitalized, we're getting to a point where it is beginning to really hit home for a lot of folks. I know 4 individuals who are friends of mine have tested positive. Several of them have had very serious health implications. In the last day, I spoke to several of them over the phone who asked that we convey to the public the seriousness of this illness, even on those who are young and generally healthy. It can have very serious health implications, and that is why we are asking for the public's help and cooperation in the physical distancing efforts that we have laid out, in the stay-at-home orders that have been given, the mass gathering restrictions that have been put in place. We want you to be healthy. We want you to go outside and go for a walk or a run, but not in large settings. And family units can participate in things together. And I come from a large family unit, but some of the pictures we're seeing of folks at parks and at beaches and areas are clearly not one intact family unit. And so the severity of this does lead us to remind the public to please adhere to this, because even if you feel young and healthy, it could still have a very serious health implication. But also, you are endangering other folks. If you contract it and you are contagious, you are putting at risk those vulnerable populations. And so we are asking for the public, particularly in these public settings, to please adhere to the guidance and advice that have been given out. They're all in an attempt to flatten the curve. If we can slow the rate of transmission, if we can slow the rate of spread, then those folks who need critical services, hospital services in particular, will hopefully have the ability. We can maintain the integrity of that system, but it really is incumbent upon each and every one of us to do our part to ensure that that system remains viable and available for those who would need help. Another part of our efforts is to try and increase the capacity of our healthcare system. This morning, a number of us were on a call with the leaders of all of the healthcare systems in San Diego County, working through a variety of issues, including how we can come together to try and increase the capacity. And I'm incredibly grateful for the leadership of all of our healthcare systems in San Diego County for their collaboration, for their cooperation, and the creative steps that they are taking to make sure that we can begin to increase that capacity. And in particular, we are grateful for the state of California. Late yesterday, we were notified that San Diego has been selected for a mobile field hospital. This is essentially a configuration of supplies and equipment that, provided we can identify the proper location and siting of it, could provide up to 250 new hospital bed capacity in our region. We are going to work with our healthcare providers. We're going to get details on what's coming. It could be stood up in a standalone location, or it might be more appropriate to augment existing healthcare services and systems. But we do appreciate the state of California's continued effort and the federal government's continued effort to help us, not only as we flatten the curve, but as we rise the level of available healthcare capacity in our region. But these increased capacities only work if we have the healthcare workforce to help us meet the need. And although we have activated our Reserve Health Corps, we are asking for any individual who may be out there who is a healthcare provider, who is not currently employed or busy, or who has extra time that would be interested in volunteering, maybe a doctor or a nurse who recently retired, we are asking you to go to healthcarevolunteers.ca.gov, healthcarevolunteers.ca.gov, and fill out a form with your information, with your specialty, with your availability, because anyone out there who is a healthcare provider, we want to make sure, if you have available time and you're willing to contribute, that we can put you to work to help achieve the aims of increasing our capacity. If you have a local question, you can email us at mrc-volc.hhsa@sdcounty.ca.gov. And so we appreciate anyone's participation there. It's also not just the physical health needs that we are trying to address. Here at the County of San Diego, we are very aware that issues of financial distress, issues of anxiety and isolation could be triggering mental health challenges in our population that's out there. And so we are going to continue to ramp up and provide more services and help and support for individuals who are out there. If you are in an emergency situation, our emergency networks still exist and are functioning. You can call 911. If it doesn't rise to that level, but you feel that you need help, our Access and Crisis Line is a powerful resource to help you if you are having a mental health crisis. That number is 888-724-7240. 888-724-7240. Help is available to you 24/7 in over 150 different languages. And then there are some small steps that we can all take to help maintain our pathway as we go through this. Maintaining routines related to meals and exercise and bedtimes. Connecting safely with others, maybe via technology or video chats. And while it is good to stay informed, perhaps avoiding too much exposure to news sources, inflammatory sources of information, or a point we've made repeatedly, the random speculation and rumors that tend to get spread at any point during a crisis. We would really encourage you to trust reliable sources of information. Our county's website, coronavirus-sd.com, is a valuable resource. And then really encouraging within your family open conversation, within your family unit about folks' anxieties and concerns and fears, to talk about them, to talk through them, and then reach out to us. More information on mental health and coping with COVID-19 can be found on the county's Behavioral Health Services website, and we stand ready to provide all of the assistances that you may need. And then in closing, I just want to share that although maybe at the national level things might spill into a state of bickering from time to time, here locally we are all moving forward together. Today we saw our hospital systems working collaboratively. We had a number of us gather, some in person and some virtually, with elected leaders from city, from state, from all political parties of providers who are all coming together to find every way that we can possibly move forward together. We've reached out to a number of businesses, both on the philanthropy side and in access to resources and buildings, and every time we've asked for help, the answer has been yes. And so I think San Diegans should take comfort that through this uncertainty, our community and our institutions are coming together and working together, not just out of a spirit of connection or community connection, but out of a spirit of what I've heard described as community solidarity. Solidarity being a very powerful word where everyone comes together in their unique way to meet the challenges we face. So thank you to everyone out there for all that you're doing, and we will continue to move full speed ahead. Next, I'd like to introduce Dr. Wilma Wooten, our Chief Public Health Officer.
Good afternoon, and thank you, Supervisor Fletcher. Welcome, everyone, and thank you for being here. Globally, the novel coronavirus pandemic has resulted in over 300,000 positive cases and almost 13,000 deaths. Nationwide, there are 24,148 positive cases, and we've had 285 deaths. In California, we have had 1,224 positive cases and 24 deaths. And for San Diego, at the close of business yesterday, we reported 159 positive cases and 0 deaths. Now, we have 2 cases in the age group of 10 to 19, and from 20 to 59 years of age, that's where most of our cases are found, and that is 120 cases. Just want to give everyone a heads up that at the end of today's report that will be posted online, we will be reporting our first death for the County of San Diego. This is a resident of San Diego County. It is a male in his early 70s who was being cared for in Santa Clara County after returning from travel to Hawaii. Our sympathies and condolences go out to this individual's family and friends. This is all the information I have or can release at this time, but I really just wanted to let everyone know that this was coming at the end of the day. Now, I think it is vital to again mention that everyone should not be tested. This message is being given at the federal, at the state, and at all local levels across the nation. Individuals who get COVID-19 mild to moderate symptoms should self-isolate themselves at home. If you develop worse symptoms, then you should call your healthcare provider. I am personally asking again everyone to adhere to the governor's executive order by staying at home. We are hearing about extraordinary examples of how people, businesses, and organizations are complying with the order by staying at home, not gathering with non-household members, working remotely from home, or taking online classes. We want to thank all of these individuals for everything that you've done and will continue to do, because this will be a long haul. Unfortunately, there are also examples that we are hearing of people that are gathering at the beach and other locations and not adhering to the social distancing order and directives that have been given. Please, I implore you to not gather with any non-household groups. Please adhere to the 6 feet social distancing rule when you are in areas with non-household members. Per the governor's order, not following the order is a misdemeanor subject to a $1,000 fine. We are asking the public to use their judgment and to follow these guidelines. This is for everyone's health and safety. If you have concerns, we are asking that you use the non-emergency number for your jurisdiction to contact local law enforcement. Staying at home helps in 3 really big ways. This action helps to protect our healthcare providers and keeps individuals with mild to moderate symptoms out of our healthcare system, in our emergency departments, and out of our ambulatory care clinics. This action helps to protect our most vulnerable populations, our older adults, individuals with underlying medical conditions or compromised immune systems. And this action separates those who have symptoms from those who do not. So please stay at home to help San Diego County bend the curve so our healthcare system is not overburdened. Every one of us has a role to play to help bend this curve, as we've all too often mentioned. Now, please welcome Dr. Eric McDonald, who will provide additional information about our COVID-19 response. Dr. McDonald.
Thank you, Dr. Wooten. I actually have two just brief updates. The first is on the federal quarantine at Marine Corps Air Station Miramar. There are currently 192 individuals there. 130 of them are California residents. There are 4 individuals who are currently hospitalized in local hospitals. There are 8 that are being cared for at a healthcare facility that is off the base, and that is the current status. There are no planned flights today, but it's worth remembering that this operation began on March 10th. So if you know about quarantine, it goes to 14 days. There will be a number of individuals who will be leaving between the 24th and the 26th, and we anticipate that all those individuals will be able to go to their homes having completed their quarantine. The other update I'd like to give is on cruise ships that would be coming to San Diego next week. We're working closely with the Coast Guard, the CDC Quarantine Station, the CDC Cruise Ship Task Force, the Port, Customs and Border Patrol, the city, and of course the Cal OES, in order to prepare for 2 cruise ships which will be arriving next week. The first is the Celebrity Eclipse with about 2,500 passengers on board, followed by the Mas Dam later in the week. We will be meeting daily until those ships arrive to ensure that it is safe to allow the individuals on those ships to proceed to their homes. The information we have at this time is that all of the passengers and the crews on those 2 ships are healthy with no significant influenza-like illness and no COVID-19 cases. If you look at their itineraries, they've been at sea for almost 2 weeks and essentially have completed a quarantine at sea. So those individuals should be safe to go through San Diego to their homes of record. Next I'll be followed by Rob Stills, who is our director of the Medical Operations Center.
Thank you, Dr. McDonald. There's a lot of questions and conversations around medical supplies and how they're distributed to the healthcare community. We want the public and our local healthcare workers to know that we are dedicated to supporting them to ensure they can remain safe while providing the highest level of quality care to the patients who need it. We understand that we have to take care of our healthcare workers so they can take care of our patients. This chart shows the number of requests we've received from first responders, hospitals, and other healthcare providers through the Medical Operations Center as of close of business yesterday. We are in regular communication with the hospital command centers to look at their daily burn rates, what are actually being used, to help us efficiently project future needs and prioritize all requests that we fulfill. We also submit requests to the state and federal government for needed supplies, and they go through a similar process to prioritize and fulfill them to us. We know some items are in low supply nationwide. The personal protective equipment includes eye protection, whether it be goggles or a face shield, respirators or masks, gowns, and gloves. There is currently a nationwide shortage of face shields and gowns, and as soon as we get them, we will be giving them out to those who need them. In fact, we're expecting a delivery from the federal government through the state tomorrow, and we will use that delivery to fulfill requests immediately. Some PPE supplies are included, but not the full quantity that we requested. I want to also emphasize what you've been hearing our doctors say. If you're not symptomatic, don't wear a mask. When someone does not have symptoms and they wear a mask, it takes a mask away from our providers who are providing care to our patients. So with that, I'm going to introduce Dr. Nick. Thank you.
Thank you so much, Rob, and again, a sincere expression of appreciation to all of the folks in our Emergency Operations Center who are tirelessly working behind the scenes. Live Well San Diego is the theme that drives us, and for some of you that are just perhaps tuning into the county based on what's happening for the first time, we want you to know that much of what we focus on is on prevention. I'm not going to repeat what Dr. Wooten said, but I will share with you in the flavor of Live Well San Diego that some of our clinicians today came up with a new phrase for you to keep in mind, and that is stay home and stay well. With the caveat that if you develop symptoms that are concerning to you, please take the appropriate act of initiating contact with your healthcare providers. It has been stated adequately, we do not want folks who have low-grade fevers and mild symptoms showing up at any of our healthcare facilities. Also want to emphasize the theme that was discussed yesterday, without alarming, but with dried-eyed realism. We are still in the eye of the storm, and we are asking you not to board up your windows, but to board up yourselves at home, please. Thirdly, I do not typically use media events to address my healthcare colleagues, but we have almost 10,000 physicians in our community and many more nurses. And it has to be acknowledged that there are some challenges and perceptions and concerns in our community. This past week, under the leadership of Dr. Wooten, the involvement of Dr. McDonald, and other clinician leaders, we did something very interesting called a virtual town hall. That video was sent to every physician in San Diego County last night, whether or not they are members of the Medical Society. Though it was a collaborative effort between the Medical Society, our local hospital association, and the county. I am aware that the Hospital Association will be forwarding that information broadly to their networks, if not today, perhaps tomorrow. I would encourage folks in the clinical community as a resource to take a look at that video. It addresses many of the issues that we have discussed here publicly with a little bit more focus on you clinically. And lastly, to those frontline healthcare providers, including our nurses, our first responders, our healthcare workers, our doctors, we are with you. We are united. We appreciate you. We ask the community to show that appreciation as well. Thank you very much. Chairman Cox.
Thank you, Dr. Nick. Before we get to the questions, let me once again just acknowledge Loisine Solman, who is our American Sign Language interpreter that's doing such a great job with us here. At this point, we're going to go to the questions. Again, we would ask you to state your name and the outlet that you're affiliated with, and we'll go to the first question right now.
Hi, we have NBC7. Please state your name, outlet, and question.
Hi, my name is Claudette. I'm with NBC7. One question I wanted to ask you guys, what happens to the people who don't have insurance? For those people who have severe symptoms and feel like they really need to get checked out, what happens to them if they just don't have insurance?
Thank you very much, and that is the population that we are most concerned about, and we have a tremendous amount of resources in place for them. I want to make it clear that for individuals who have concerns about their symptoms, who may not have any other option, the resource in our community, which Chairman Cox often talks about, is 211. With partnership in 211, there are now nurse call-in triage lines that are available for individuals to be able to reach a nurse, to be able to get medical advice, and if needed, to then be referred to an appropriate, what we call in our region, a federally qualified health center. We have a network called the Health Center Partners, as well as a network called Family Health Centers of San Diego. They are part of this collective effort and totally there for the people in our community who may not have private health insurance.
Okay, next question.
Hi, we have ABC
Hi.
10. Please state your name, outlet, and question.
Hi, Vanessa Van Hefty with ABC 10. Last week, you asked county residents to sign up for those text alerts, but have not sent any about new numbers or information. What is that alert system supposed to be used for?
Dr. Wooten?
This alert system is to be used for individuals that want to get information on any specific topic. So we can provide that link to you so that you can disseminate it. But anyone who goes to the web page, you can sign up to receive specific types of information, and then that information will be sent to you.
Okay, we'll go to the next question.
We have the Union Tribune. Please state your name, outlet, and question.
Hi, this is Gary Worth at the Union Tribune. Yeah, I had a question about homeless outreach, and one was the homeless, the public health nurses who are going out. What kind of response are they getting from homeless people out there? And is there an understanding about what this virus is and how they would, prevent it? Or are there any weird rumors that they're hearing about the virus? And also, is there any talk about perhaps opening up some other public facilities to take in people who are homeless so that they'd be better sheltered at this time?
I'm going to ask Supervisor Fletcher to answer to that question.
Thank you, Gary. Our public health nurses are not only in our 9 shelters across San Diego County, but as you mentioned, with our homeless outreach teams. And they are out every day engaging with unsheltered individuals. We have pamphlets of information to share with them, facts. We are distributing hygiene kits, along with the ability to link them to services. One of the great benefits of having these public health nurses out there is they can dispel any rumors that they may encounter and provide factual, substantive information, and so they are doing that on a daily basis and doing a very good job of it. As it relates to your second question, there is a great concern about the need to increase our capacity, our sheltering capacity, along with the need to ensure physical distancing in the existing shelters, and a large number of folks, the Regional Task Force on Homeless, the Mayor of San Diego, City of San Diego County, and other partners have been working very hard to come up with additional options, and I think in the coming day you will see some announcements about some of those efforts, but there's been a tremendous amount of effort put behind doing those, and those efforts will continue. Thank you.
Okay, I believe we have one more call-in question, and then we'll go to the text questions that have come in. Next question.
KPBS, please go ahead and state your name, outlet, and question.
Hi, Max Rivlin-Mathler, KPBS. Are gun stores considered a critical business, and are they being allowed to stay open right now? And Supervisor Fletcher specifically, do you have any comment on reports that gun shops are seeing record sales in response to the pandemic?
Do you want to talk about it first? Go ahead. Go ahead. We'll go.
The question is it legal for gun shops to be open? That's the question. And what we will do is send you the list of, the state has compiled a very comprehensive list of what can remain open and what should not remain open. And off the top of my head, I'm not sure if gun shops are included in that list. I'm thinking that they might be, but we will do that research and send it to you. And if we find out about it before this conference is over, we will let you know as well.
And I think in response to the second part of your question, having a gun will not stop the coronavirus. And I think that there is a lot of anxiety that we see out there, and there's a lot of fear that we see out there. But the reality is we are going to maintain order, and we're going to make sure that no one starves and people that don't lose their homes. And I think it's really important as a community that this is a time that we come together and provide comfort to one another and not stoke fear or anxiety. And so I think we certainly understand the very real concern that folks have out there. But we are going to get through it by adhering to the guidance that we've given. We're going to get through it by leaning on one another, supporting one another, and working together. And I think that is the overwhelming sense and sentiment that we see out there. So we would really encourage people to hold true to that spirit.
Okay, now we'll go to the texted questions. The first one, please.
First question is from Marilyn Hyder with Kogo News. Are hair salons and nail salons allowed to be open? Last week, Dr. Wooten said they were considered essential before the governor's order. Is there an order regarding these businesses?
Dr. Wooten?
We are following the governor's executive order, so they are not to be open. They should be closed. And as I stated in my opening comments, if there are concerns that citizens have, they can call their local jurisdiction's law enforcement.
One quick clarification. We are quick at the county. We consulted with our county council. It is not our belief that gun stores are essential businesses based on the governor's executive order, and so therefore they should not be open in the county of San Diego. Thank you.
Okay, let's go to the next text question.
This question is from Gina Yarbrough from the San Diego County News. There have been there have been concerns from the public about COVID-19 surviving on the surface of boxes. With the increase of home deliveries, what safety measures should the public take to protect themselves and their families?
Dr. Wooten?
In all too many cases, you've heard me say the virus can be on your hands, but if it does not get into the respiratory system, you cannot be infected. So if you are touching objects that have been out in the environment, wash your hands so that you are not touching your eyes, your nose, or your mouth. So if you get deliveries, when they are delivered, unpack them, and then wash your hands before doing anything in terms of handling food, before touching your face, or before doing any other things in your household involving your family members. So again, washing your hands is very important. I think I reported yesterday that the virus can be on cardboard for about several hours. So it depends on when the first contact was made. But that really is not important. What's important is washing your hands after handling these boxes or merchandise that comes to your home that are boxed.
Okay, next question.
This question is from Jane Morton with CBS 8 News. San Diego police have closed beach parking lots and Fiesta Island because of the stay-at-home order. We know county beaches have been packed as well. What, if any, action does the county plan to take if people keep flocking to our beaches? And as a follow-up question, what is your message to people who have been ignoring the stay-at-home order?
Dr. Wooten?
In my opening comments, we commended those individuals, businesses, organizations that are following the orders. But we know, and as all of us migrate through the community, we know that there are some individuals that are not. So again, law enforcement has the lead on, or our sheriff's department has the lead on developing training for law enforcement regarding this nature. So if you have concerns, we're asking people to call their local law enforcement number in their jurisdiction. Each jurisdiction would handle any incidents that do not comply with the executive order.
Next question.
The next question is from David with CBS 8. When in the future do you expect the supply of test kits to ramp up so those with mild and moderate symptoms can be tested?
I think Dr. McDonald is going to answer that question.
That's a very good question, and I will say that we are working closely with our local healthcare organizations, actually our local industry, and the national commercial laboratories to increase the number of tests that are available to San Diegans. This is a national issue, but there are some very innovative local efforts to stand up first testing for those who need them. And those are individuals in the hospital, our frontline healthcare workers and emergency and pre-hospital workers, and those who work in skilled nursing facilities. Those are our highest priorities for individuals who may be exposed or ill. In the meantime, it's important to emphasize that you don't need a test to do the right thing. And the right thing is stay home, especially stay home if you have symptoms, and contact medical care. I'm sorry, I'm looking in the wrong direction since I'm looking at who's asking the questions. Anyway, thanks.
Next question, please.
This question is from Lisa Halverstadt with the Voice of San Diego. Last night, Governor Gavin Newsom gave San Diego County kudos for securing 1,900 motel rooms for homeless people. Yesterday, Supervisor Fletcher said the county had secured 1,783 motel rooms, including 200 for homeless San Diegans. Can you clarify how many rooms have been secured for homeless San Diegans and provide an update on placement efforts?
Supervisor Fletcher.
Thank you. We are right at about the 2,000 number in terms of rooms available that are split between our public health rooms that are available for any unsheltered individual who is experiencing symptoms, is a PUI or has a positive test. We also have several hundred rooms that have been allocated to the Regional Task Force on the Homeless that they are filling with unsheltered individuals who are 55 and older with a health condition, or anyone 65 and older. We are going to continue our efforts to increase and help assist the Regional Task Force on Homeless as they increase their capacity of rooms, and we will continue to provide regular updates on the total numbers in both population, as well as beginning in the near future to provide the occupancy numbers. Thank you.
Okay, I believe we have one question left.
This question is from Marilee Moore with Fox 5. Is there a concern about workers in the food industry and in drive-thrus at restaurants about not wearing masks? Should they be wearing masks?
Dr. Wooten.
Well, in drive-through, we ask everyone to adhere to the 6 feet social distancing. And 6 feet, I think, is reasonable between when you're driving through, someone is giving you your food, and you're driving off. And it really, you don't want to have contact with anyone for any more than 5 to 10 minutes. So that drive-through process is very brief, and we do believe there's 6 feet between the person who's taking the order and the driver that's in a car going through drive-through. And the same would be for if you're going to pick up food or place a takeout order inside. Yeah.
Before we conclude today's media availability, we want to again thank Governor Newsom for his very kind comments about San Diego yesterday and how we're doing with the gathering together of hotel rooms and hotel beds. You know, we all have to work together right now. And this virus is indiscriminate. It doesn't matter whether you're young or old, black or white, rich or poor. It doesn't matter what your ethnicity is or political affiliation or faith is. It is truly indiscriminate. And so we all need to work together as a team. We need all San Diegans to heed the state's order and stay home. A lot of you are doing that, and that's great, but we also know that there's some that are not, and we ask for their cooperation. It's okay to go outside and take a walk or get some fresh air, but we do want to discourage social gatherings. You can still visit one another through social media, through making a phone call or FaceTime calls. All of those are perfectly fine and certainly are a reasonable substitute for the next few weeks. So please stay home and stay safe. Dr. Nick made reference to Live Well San Diego, which is an initiative we started 10 years ago. And the result of that is we've seen a lot of deaths go down, including the incidences of heart disease and stroke and obesity. It's been a great campaign, but now, again, we encourage people to live well, but to live well and to stay well, you need to stay home. So we ask for your cooperation, and we certainly hope everyone will comply. With that, we will conclude today's media availability. We will be here tomorrow afternoon at 2:30. Thank you.